What is the incubation period of hepatitis B, HBV? A. 1 to 2 weeks. B. 2 to 4 days. C. 1 to 6 months. D. Up to 2 years. The answer is C. 1 to 6 months. Hepatitis B has a long incubation period. From the time of initial infection, symptoms might take from 1 to 6 months to appear. A patient just returned from a trip outside of the country and is now experiencing fever, nausea, and vomiting. She tests positive for hepatitis A IgM. She would like to know if hepatitis A is a chronic infection, or if it will resolve with treatment. The nurse should advise her which of the following? A. Hepatitis A is not a chronic disease and it does not exist in a carrier state. Once the infection is resolved, you will no longer have hepatitis A. B. Hepatitis A becomes chronic in 25% of cases. Monitoring for viral DNA should be repeated every 6 months. C. Hepatitis A becomes chronic in 75% of cases. Monitoring for viral DNA should be repeated every 6 months to 1 year, but you will likely always carry the disease. D. Hepatitis A generally does not become a chronic infection, but you will always be a carrier of the disease. The answer is A. Hepatitis A is not a chronic disease and it does not exist in a carrier state. Once the infection is resolved, you will no longer have hepatitis A. Hepatitis A is a generally benign, self-limiting disease that does not develop into a chronic hepatitis. It also cannot exist in a carrier state. Once the virus is cleared by the immune system, the individual will no longer carry the virus or be infectious to others. Hepatitis B can be transmitted via any of the following routes except A. Blood. B. Stool. C. Vaginal fluids. D. Semen. The answer is B. Stool. Hepatitis B is primarily transmitted via blood, vaginal secretions, and semen. While the virus is often present in saliva, it is not generally spread by sneezing, kissing, or sharing utensils, unless there are oral abrasions resulting in a mutual exchange of blood. The virus does not have fecal-oral transmission. A patient with pancreatitis is placed on an NPO order. What does this order mean? A. The patient cannot walk. B. The patient cannot eat only. C. The patient cannot drink only. D. The patient cannot eat or drink. The answer is D. The patient cannot eat or drink. NPO means is a Latin phrase meaning nothing by mouth. This order is used when a patient is not allowed to eat or drink any substances, usually due to a disturbance within the GI tract or if they are scheduled for a surgery. NPO orders are common in the ICU and surgical setting. A client with Crohn's disease is asking the nurse how to accomplish a low residue, low fiber diet. The nurse will tell the client to avoid A. White bread. B. Cooked potatoes. C. Refined pasta. D. Apples. The answer is D. Apples. Crohn's disease is an indicator for a low residue, low fiber diet. The diet should include foods that are unlikely to obstruct the intestinal tract if narrowed by inflammation or scarring, or if gastrointestinal motility is slowed.